Ariadne, supposedly having all of the benefits of the trippy drugs, but without any of the trips. So why did drug companies shelve this? So Ariadne, also known as 4CD or 4C-DOM, is a drug that was one of them developed by Alexander Shulgin. Now, one of my most patient and persistent TikTokers, Masha, has been asking me to do a video about this drug for a while, and I've kind of just put it on the back burner. Sorry, I really do appreciate you, but honestly, sometimes I just get sick of talking about the alphabet soup drugs. And what I mean by that is like all of the drugs that Alexander Shulgin made. So if you were unfamiliar with this wild man story, basically he was a chemist who, as part of his job, ended up just basically designing new drugs. Now, to this day, I am not 100% certain of what Alexander Shulgin's job actually was. So, it seemed to be just coming up with different drugs, and then he experimented on himself. So this is just a series of scientific papers of here, I made this new drug. I just kind of moved this specific functional group, and now, new drug, let's see how it works, and then let's test it on me, and maybe my dinner party too, and then let's write down the effects. Apparently, at multiple points throughout his life, there was a job that was paying for this. Now, I must say, as a drug scientist, we do get weird things that we have to do in our jobs. So, for example, in a couple of weeks, I'm speaking at a probation officers conference. What am I going to say to them? I have no idea. If you have suggestions, please let me know. But also, I've been asked to be an expert witness, and I am currently writing a proposal to do research at Electric Force next year. So, yeah, I have a weird job too, but not as weird as an entire book in which you are just studying yourself and drugs. This drug, which is one of the alphabet soup drugs that Shulgin created, is actually more interesting in some ways than others. So he did seem to actually find that thing that he set out for, a hallucinogenic drug that actually does not produce hallucinations. And so that is why this drug is so weird and also so coveted in certain ways. So we see that there are a lot of different benefits to the drugs that typically cause hallucinations. So they're called psychedelics in most cases, and they typically work by increasing activation on the serotonin 5-HT2A receptor. But now, weirdly, that receptor also seems to be linked to things like helping with depression or things like having mystical experiences that might help with PTSD. There are a lot of potential benefits of the 5-HT2A receptor too, but again, you got the hallucinations, and some people don't want that. Now, some people do, but some people don't. So this type of drug, a non-hallucinogenic hallucinogen, seems to be kind of the holy grail of some types of pharmaceutical research. And yeah, Shulgin seemed to have found it. So then Bristol Myers, the pharmaceutical company, actually continued along with this research. And they're like, okay, let's try this out. Let's see what it does. And they found that, yeah, it still seemed to produce some of the same effects that Shulgin said. So basically, Shulgin was like, yes, it causes you to be more alert, but none of the other effects that a hallucinogen has. And yes, it seemed to actually help with rapid remission of things like bipolar and schizophrenia. So the psychosis that you see in those disorders, it seemed to really help treat. And it helped with alertness and sociability and even things like memory in patients with dementia. And they've done studies to show that it helps with things like Parkinson's too. They even tested it with cats in some sort of hallucinogen model of cats, which I've never heard of, and I'm a drug scientist. But anyways, they tested it with cats and found that they hiss and clawed less, which was a good thing. And then they also tested with rats and found that it will substitute for things like Molly and acid. So very similar in terms of how it's working in the brain. Basically, it convinces rats that they're the same drug. But again, still none of those hallucinations in humans. And then the drug companies shelved it. They just stopped doing research into this. They did phase 2 trials. So went through all 2 of the 3 phases of FDA trials and then just stopped. Now they say that it's for economic reasons, or that's what Shulgin says that they say it's for, but we still to this day don't know. So lots of promising early data, and then we just stopped. Now, people have been trying to restart it. So in 2023, there was a new paper that came out that was, again, looking at Ariadne. And they were looking at it as a promising new therapeutic drug. So they were testing it with mouse models of Parkinson's, and they found that it really did help treat things like Parkinson's in mice. But then it also did seem to cause head twitches, and the head twitches are a model of hallucinatory effects. And so what they found was that it might be similar to the level that you see with shrooms, but there's a little bit of a problem with this method. So their worry is that maybe it can cause hallucinations, and all of the early studies just didn't show it. Maybe we've just been using too low of a dose. But nobody's studying this, so we don't know. They're actually quoting sections of Erowid as a example of what people's doses are. We don't know. We have not done the science on this. study did say that like it is the effects on the serotonin system that seem to matter here. So it produces less of the effects on the 5-HT2A receptor, so the ones that were linked to hallucinations. Still produces some, but not as potent and not as effective on those receptors. And so maybe that's the secret there. Like the secret sauce is actually just a quote, very complex pharmacology. So they're saying like, yeah, maybe we can get these new types of hallucinogens that won't produce trips, but will help with things like depression. Maybe we can make them, but they're going to be very complex. Just genuinely fascinating to me that it's actually easier to make the ones that produce like complex hallucinations and less easy to make the ones that don't. But these scientists basically ended with a plea of like, yeah, we should be testing this. And I agree with that plea. The scientists at the end of their research paper were like, yeah, so you know the original story of like Ariadne helping get Theseus out of the labyrinth by like her thread? This is what Ariadne the drug is going to do to pharmaceutical industries. Going to lead those pharmaceutical companies out of their quote innovation malaise and help them discover new drugs. And I would love this to happen. This seems like a promising new thing that we should at least be looking into, but we need to be doing the good science here.